So I'm going to start with just a basic definition of implicit bias that I'm hoping we're pretty familiar with at this point. It's been kind of the focus of a lot of conversations across our campus in the last couple of years, and especially this year with the events that are happening both locally and nationally. But I want to highlight here something I think is very important, and that is that last sentence, that often our implicit biases contradict our own values and the things that we hold as important. And I wanted to share just a quick story, a personal story about that to kind of center our conversation today. So I was recently with a dear friend at the hospital, over at the VA hospital, as he was receiving a very serious medical diagnosis, a cancer diagnosis that was terminal. We weren't expecting that at that appointment, but at that, that was what happened. And so I'm sitting with this person that I love dearly. We have this really hard information to hear and process. And then they sent us right from the oncology department, and they said, we want you to go see your primary care doctor so that they can review your medications with you. And so, I left with my friend, walked with them to their primary care clinic, and we walked into an office, and a woman sat down and started going over medications. And the whole time I'm thinking internally, when are we going to see the doctor? When are we going to see the doctor? And it took me about 10 minutes into the conversation with the person sitting in front of us for me to realize that we were talking to the doctor, in fact. And I think in that moment, it just reminded me that implicit bias happens to every single person. I have dedicated my work to making sure that women are represented in the workplace. It's a value that I hold very dear, and one that if people were to ask me about my core values, I would absolutely say equality and opportunity, regardless of gender, is a value that I hold dear. But in that moment, my brain was doing something different. And I think that's important for us to understand about implicit bias, is that in that moment, my brain was on survival mode, trying to focus on, maintaining my composure while supporting my friend. And so that critical thinking that needs to happen in order for us to sort through the information that the brain is taking in was not available to me in that moment. And so I just want to share that as a way to help us all understand that implicit bias quite often happens in contradiction to the things that if we were to have an intentional conversation might reflect something different. Physical implications on the impact of implicit bias and microaggressions. And important to keep in mind here that this is not always just a one-time event where something happens, but a lot of times these are things that compile over time. And so small things that sometimes make us pause, but then we write it off and we go on. But those sorts of experiences tend to accumulate over time. And what we see is an impact on our ability to problem solve, our ability to learn, our ability to work well, and just an impact on our overall physical health, because all of these things over time can impact our physical health and well-being. And so these are important. There are a lot of ways to address this, and we're going to talk about that in the second part. But I think it's important for us to recognize that there is a personal impact when we are the target of implicit bias and microaggression. From a structural perspective, we have to understand that there are policies and practices that sometimes can perpetuate the impact of implicit bias. When we think about higher education specifically, I think it would be wise for us to take a critical look at our admissions processes, our hiring practices, our promotion and tenure policies for faculty, curriculum and how it's developed and whose knowledge we're valuing as we develop curriculum. We're starting to have those conversations among our health sciences faculty this month and in October, and it's I'm excited that we're finally starting to have those conversations. Also, the role of the institution in its communities, so VCU and VCU Health has a specific role to play in our community. And the impact of implicit bias from a structural perspective means that we need to understand how the community sees us as an institution and how we can forge a relationship that is productive and meaningful for the community. But the impact of implicit bias on how we go about that is something that we have to take into account. And then very importantly, from a practitioner perspective, if we're not aware and if we're not understanding how implicit bias can impact relationships, then there is going to be, I believe, a direct impact on the quality of the healthcare that we deliver, the impact on our ability to work in an interprofessional context. So healthcare is a team endeavor. And so if we don't understand the impact of implicit bias on us as practitioners, it is going to impact our ability to work together with our colleagues to affect positive patient outcomes. And then again, community relationships. So understanding who you are in relation to the community that you're serving is also a very important place for practitioners to develop some practices that will help us mitigate the impact of implicit bias as we seek to build those relationships in the community.